Nationwide, there is clearly a public health crisis. The reason we do this is to prevent bloodborne infections, especially HIV. According to the federal government, 14% of HIV-infected individuals still do not know they are infected and therefore are at very high risk for spreading this disease. In looking at new diagnosis of HIV infections, now these are rates per 100,000, and I would direct you to the first light blue line, which is the Santa Cruz diagnosis of HIV infection. It goes up to 2014, but you will see in the board letter that we actually have data through 2016. And in general, the rates of HIV infection have been pretty stable here in Santa Cruz. Hepatitis C, however, is primarily due to injection, and the spread of hepatitis C is usually through the use of unclean needles. So there is another problem with this, and I will mention this because of the data that we have nationally and even locally is somewhat soft data. The problem being that some people with hepatitis C have had it for 30 years, and this data does not distinguish those people who have had it a short time and may have gotten it in the last several years from those people that may have gotten it 30 years ago and are just being reported now. The federal government has said that there is a 300% increase in new cases of hepatitis C, but we're really not sure those are all new. And we are currently digging into our local data to try to get a better handle on that. In 2015 to 2017, which is in your board letter, we do see a slight increase in the number of hepatitis C patients, but again, the data is somewhat soft.
And I wanted to remind the board as well as the public that we're forming this commission because Syringe Services is a very important piece of the work that public health does. And Syringe Services programs in California are under the guidance and the advisement of the California Department of Health Office of AIDS. It's important to remember that Office of AIDS oversees our work because one of the biggest and most important roles that these programs play in local communities is to reduce the risk of transmission of HIV and other communicable diseases. In Santa Cruz County, a significant number of our new HIV cases that are newly diagnosed are already in full-blown AIDS. So what that means is that these people have gone diagnosed for a length of time, perhaps a number of years. So for me as a health director and a public health practitioner, it underscores the importance to bring us back home to the reason we have Syringe Services programs.
Engine 3110, Medic 4, code 3 medical officer jail, 259 Water Street, across the East Levee. FH 721B Boyd is going to be at the Sally Port for a 33-year-old female, not conscious, not breathing. Possible overdose, CPR in progress at 6:55.
Tom, engine 3112. We're available in quarters. We'll take the call at the jail.
3112, I copy. 3110, you can stand down. You copy?
3110, copy.